ortho, you want your teeth straight, right? The crap I gotta go through. Okay, let's see what crap you gotta go through here. Okay, all right, gnarly. Does happen. This is actually what we call a frenectomy. If you've never seen that, okay, let's see what else we got. Okay, looking like some rubber bands. This is actually a pretty good illustration of what kind of happens to your jaw. You can kind of see how your jaw moves there whenever you're pulling. That's actually kind of physically kind of the way your teeth kind of shift. And you can actually see, I'm gonna pause it right here on the side. Oh no, he's taking teeth. Okay, so this is how you do it. Okay, now let's go back through all these things and talk about. Okay, so the first thing that we've got is the frenectomy, okay? This is normally done for people who have an attachment here that hooks up to here. This can cause a big gap between your tooth. Now, what we do here is we make sure that we close that gap first. This is really important for people that need frenectomies out there. Please, please, if you take anything from this video, take this. If you have a gap due to your frenum, which is this thing right here sticking down between the middle, you have to get it orthodontically closed before you get rid of that frenectomy. Because if you don't, it will form scar tissue, and then that gap will stay open forever. And even if we close it with braces, it's gonna shoot open. So if you're a kid and the dentist is saying we need to get a frenectomy, please go see an orthodontist before you ever touch any frenectomy, no matter what age the kid is. Please go see an orthodontist before. Okay, the second one, we kind of already talked about the rubber bands here that are showing. That is a pretty good deal. I mean, the point is just to kind of grow the jaws in a formation to where you can kind of see what's going on. Now, that being said, in this next one that you're gonna see here, when they stop it, if you look at these little blue lines you see, that's actually kind of how we look at your bite, whether you're an underbite, overbite, or regular. We want that front blue line to be directly on the lower blue line. Those should be in the saw. So hers is a full step forward from where that is, and that's causing her to be in this underbite position. So what they're saying is, if you're really gnarly, or a full step class 3, a full tooth of a class 3, meaning you're a forward lower jaw of an entire tooth, there is a way that you can do this by removing teeth. And so what you're gonna see is, as we unpause this, they remove those teeth and pull everything back. Now, what that does is it basically puts your lower jaw directly exactly where you want it, because if you're a full tooth forward, you get rid of that tooth, now everything balances out. Now, I don't like to do that because I don't like to close down space, which can cause airway problems, all that. I would love to try and do it with rubber bands. You can do it with rubber bands. If you really wear them and you do a great job and you have a self-ligating bracket like a Damon system, it is possible. I've done it tons of times. Now, that being said, if you really don't want to do it from there, jaw surgery may be an option. And if you really don't want to do a jaw surgery, then the final thing is the removal of teeth, which I don't like to do, but sometimes we got to do it.